pay a lot of attention to the healthcare areas. Healthcare is a problem everywhere. You see a healthcare problem here is a big political issue, political debate in this country. In our countries, it's not a political debate, but it's rotting. It's just falling apart. It's something that common people doesn't have the benefit of the system because of the way it's working. Everybody knows it, but nobody understands how to handle that. For two reasons. One, the government system, actually health is supposed to be a government service, which is to be provided to all the people. And we have a nationwide healthcare service. We have health centers, clinics, health complex, superficial health complex, and general hospitals, district hospitals, and so on. So all government funded. And we have almost all the doctors in Bangladesh recruited by the government of Bangladesh immediately after they come out. If they don't get jobs, doctors complain that why government is not giving the jobs. As if as soon as you pass, it's government responsibility to absorb you. And this system have been working that way. And then there are private hospitals. Private hospitals, of course, they cater to the people who have the money, who can afford, and they try to make it as expensive as people can afford. Their main target is there are hundreds of thousands of patients from Bangladesh who go out in India and also in Thailand, also in Singapore. So this is the common thing. So the private sector came out to take care of those patients who are going outside. Their argument is a good argument that why we spend the money there, we can provide you here. Many of the hospitals are coming out to take on that. But that doesn't take care of the common people, which is a large number of people. So the common people are missed out everywhere. And we are trying to build up a healthcare program for a long time now. So we do it in 54 different spots within Bangladesh. We have 54 clinics with doctors, nurses, and health assistants, paramedics, and also pathological lab. And we build it up on the basis of health insurance, which we designed our own health insurance inside the system. We run it through, we created an organization called Gramin Kullan. So through Gramin Kullan, we do these healthcare services. And the healthcare insurance is a very simple thing that we designed in our own way. If you are a Gramin Bank borrower, if you pay 250 taka per year, your entire family will be covered with insurance, health insurance. We provide you everything. But you have to pay 250 taka a year. And they pay that money. And if you are a non-Gramin person, you are not a Gramin borrower, you pay 350. You get the same result, the same way. There will be a medical doctor right there, MBBS doctor in your village. And you can see the doctor anytime you want to with your card that you have the whole health insurance. And he will give you all the checkups and prescribe medicine. And for each time you see him, you pay 5 taka as a kind of fee for him. And medicines will be available. You can buy it from here at 25% discount, or you can buy from the market where it is up to you, it's free. And we have pathological labs, so you don't have to go to the city to go to urine tests, stool tests, or blood tests. It's very simple kind of thing. So we have the village level pathological lab.
For pathological, does they need to pay another extra amount?
Yes, 2 taka, 5 taka, something like that. Very simple. Not very expensive. So that you cover all your cost. So we built the system which will be self-supporting. And it was working well. So we have out of 52, I would say half of them, they cover their costs, so we have no complaint. But another half don't make it. Not some of them 80%, some of them 90%, some of them 70%, but very close. And we can easily move from 70% to 100% plus. But the problem is we cannot keep the doctors. That's our problem. We keep on paying higher and higher salaries to the doctors because they leave very soon. Initially they will accept the job. The moment government is recruited, you can't tie up those doctors in the village with the strongest rope you can get. That's for good reasons. Why should we have work here if I have to get a government job? And government job is so attractive. In a Bangladeshi situation, you don't have to work. brothers and sisters and
Yeah.
doctors, we'd see the same
Yeah,
thing.
we do.
The same thing. You are assigned to a Bujala Health Complex, you are supposed to be working there. You go and pick up the check, monthly check. You do somewhere else. You have a private practice somewhere else. That's became the system. So anyway, so that became a big problem. So over time we are wondering what to do with this. So one of the things that recently we came up with was, okay, let's decide that we have to build up a healthcare system without a doctor. That's the only solution. And we made it very clear, and doctors understand that. But there we are saying that it's not actually a healthcare system without doctor, but a healthcare system with a distant doctor. The doctor doesn't have to be physically present in the village. We are using as much as possible now all the technology these days are available. Because as you know, in Bangladesh now everybody has a cell phone. This is a big help to bring healthcare system to the cell phone. So this is one. And then many other, with internet and other things you can do that. First thing we did, we want to change the health clinics that we have, trying to redesign it, and we are calling it Grameen Health Management Center, rather than health clinic. The idea of health management center is, first of all, the goal of the management center, first goal of the management center would be to keep the healthy people healthy. So this will be our first goal, meaning prevention, so that you bring in all kinds of policies and reductions, so that people don't get sick in the first place. Once you have done that, and your first priority will be, second priority after this one, will be early detection. If something goes wrong, you detect it right away. Don't let it wait for long. And then obviously early treatment. So this will be our first responsibility of that. As a part of that responsibility, immediately we thought we'll make this health management center as a very strong diagnostic center.